of view, the problem coming that we are looking to the healthcare system vertically, not horizontally. When we say private healthcare center, polyclinic, single clinic, all of this is called vertical views, which every one of them can deal with the urgent care. But we should, with this is what I dream about, how to look to the healthcare system as horizontal, as system-wise, process approach, how to make it in a sequential manner. We don't look where the service provided, what the service should be provided. Instead of where, we should look at what and how. So the concept of urgent care, as I told you, this is my own practice and my experience in Saudi Arabia, 14 years in Mecca region. And I was overseeing more than 35 hospitals, more than 300 PHCs all over the Western region, where I discovered that exactly I can say it, 85% of the cases which is managed in the ER should not be managed in the ER. It should be managed in another setting, or not setting as a place, setting as a system, which is now, it is named, alhamdulillah, as an urgent care. Because urgent care, at that time, it is not understood or not spoken. But on reality, 85% of the cases in the ER should not be in the ER and should not be an acute in the hospital at the same time. So this urgent care as a system, as a process, it should be. That's why, and I would love to have it standard-wise to be clearly stated that what's the end to end, what's the start and what's the end. And for sure, the start of the urgent should be linked to the emergency. The end of the urgent should be linked to the acute, what's called hospitalization. And just I will explain this in the second part, which about now international benchmarking is looking for what's avoidable admissions. Now, this is one of the most important indicators, how to assess the avoidable admission rates for healthcare, because this is with the high technology and now that either from the medication, from the facilities, from the technology, it is escalating very expensive, and we want to be more cost effective. So urgent care, if it is well clearly stated as a scope from what to what, and how the most important, how the link with the emergency and the acute, for sure, it will be very valuable added. And I think Dr. Tariq can elaborate more about the cost effectiveness of this as an urgent care. But as I told you, I don't want to look at it from the polyclinic or clinic or ER point of view. I don't like to look at it from the facility point of view. I want to look from the system point of view. I hope I answered your question.